Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Talk about this new study that shows a group has some kind of super immunity, so to speak.
Yeah, well, we knew all along that people who had COVID, who then got the vaccine, had higher antibody levels. They had a bigger response to the vaccine. And this is just more data in that same vein. And in some small studies that have been done, maybe the neutralizing antibodies can be 6 to 100 times greater in the people who had COVID and then got the vaccine. So this might be able to overcome all the problems that we have with the variants and the decreased effect and whatever. So it's just a fascinating finding.
COVID cases down for the first time since the start of the summer. Does this mean that Delta variant is on the decline, and is it going to be replaced by something else?
Well, there's two different questions. So yeah, it's definitely going down. But remember, every peak we've had didn't last forever. It always goes up and then it goes down. So now we're starting to turn the corner, particularly in the states who have high vaccination rates, like Illinois and some of the Northeast states and some of the other states. So this is really great, and it is expected. So are we going to get another variant? Yes, we're going to get more variants until we get the whole numbers of cases down to a very, very low level.
Can you talk more about the side effect for some teenage boys?
Yeah, so I mean, this was reported early on that it can be in girls too, but it's much more common in boys, more than 10 times. So they get an inflammation of the heart muscle. Now this can happen especially in the summertime because other viruses actually cause this kind of condition. It's a scary, dangerous condition, but in general, the boys or anyone who gets it recovers from it. Sometimes they end up in the hospital though. So it's a frightening thing. But now as more data comes forward, they're finding out the actual rate. So it's 162 per million. So that's your risk. So it's that's 100 per million people who get the vaccine. So this is really low. Older boys have a much lower rate, 94, and girls only 13 to 13.4. So per million. So it's a rare side effect. It's generally not life-threatening, and it's certainly better than getting COVID, although the rate of COVID is lower than that. It's like 44 per million.
All right, let's get to some viewer questions. Can children 12 and over get a COVID-19 vaccine and a flu shot?
Yes, they can combine these now, as long as they're not allergic to either one of those vaccines. They can take them together now. That was a change in recommendation that was reported by CDC August 4th.
All right, next question. When will the J&J booster shot be available?
Well, this is a good question. Now, J&J came to the table a little bit later than the other ones. They also have, independent of the booster phenomena, they have a 2-dose vaccine study with some 60,000 patients in it that's just finishing up, I think. So you're going to have the 2-dose shot study, plus you're going to have some data on the booster, but it's not going to be probably for a couple months.
In general, though, like if you have let's get to this first, then I'll ask you, is it true that vaccinated people cannot donate blood?
No, they can donate blood. As long as, they're going to be checked for symptoms, fever, whatever, like you typically do when you get blood. But these are not live attenuated vaccine products. So you can take them. There's absolutely no contraindication.
Real quickly before you go, this booster situation, if I get a Pfizer the first 2 times, can I get a Moderna booster? And when are those 2 booster shots available? Are they available now to the average person?
Well, right now, no booster is technically approved. A 3rd dose is approved if you have an immunocompromised condition, like you're an organ transplant patient or you're taking steroids, something like that. That is approved already. But the booster shot, the 3rd dose, a real booster, is supposedly going to get approved on September 20th. That's for Pfizer. Moderna came in after that, probably a month after the Pfizer booster's dose is approved, and then the Johnson & Johnson will be several months after that because they're just further behind. Now the booster will be, you can give a booster and mix like you're talking about here, mix the vaccines, take the one that's available, the mRNA vaccine, Pfizer or Moderna. They're going to allow you to do that. That should be okay. It might even be better for you. Typically, though, in the few studies that have been done, there are a few more side effects because you're actually getting a different product.
Okay. All right.
It's tolerated, though.
Well, thanks, Dr. Murphy. If you did not get your question answered, Dr. Murphy answers them biweekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or on our Facebook page.